Okay, Lisa, it's 10. We could do roll call.
Okay, I don't know who anybody's supposed to be here.
That's okay.
So I'll say so far I have.
Oh,
Mary,
I can do.
Oh,
Yeah.
I can do roll. I can do that for you. Yes. Yeah.
Thank
We
you.
just. Yeah. All right. We called to order at 10:01, and I'll do roll call. Arthur.
Here.
Councilor Jakutis absent. Jackie, not here. Betty.
Yeah.
Mary.
Present.
John.
Yeah, I'm here.
Smitty.
I'm here.
Jean Marie.
Here.
Debbie.
Here.
Go. It's good. Everyone received their agenda?
Yes. Yep.
Pam, do you want me to go first?
Yes, please.
Hi guys. So Megan can't be here today. Her husband and coincidentally her mother have been hospitalized. So I told her to please not worry about attending this morning's meeting because she was planning to, and to please take care of her family, right? Family first. You know, people were very gracious to me when I needed that time for my mom. So I want to make sure that I do that for the staff. So I figured I would show up. I have a half an hour to give you to answer any questions that you guys may have. But most importantly, what I thought I would update you about is we did receive the transportation grant for the vehicle. So, yeah, so that's awesome. Doris wrote that grant. We got it. We are, you know, in the process of signing all the paperwork and getting all the stuff. We are looking at the kind of vehicle to get. It will be handicap accessible. It will probably allow us to figure out like what van we will be getting rid of, because you know you don't want to keep 3. We do have the money for a transportation coordinator as well, and the goal is, and you know we still have to work out the details, to at least be able to provide additional transportation services at the senior center. So what I'm hopeful is that we have 2 routes in the morning and 2 routes in the afternoon, right? So we can get people to the center more quickly. So there's a longer day of programming for folks. And we can leave a little later because we have 2 routes going. And I think once the second floor is up and rocking and rolling, that we'll find that longer programming day is really going to benefit a lot of people and provide a lot of flexibility. So that's the plan. We, you know, like again, we haven't signed anything yet. So with the way things are happening left and right, you know, I got an email one day that said, hey, today's Wednesday. As of the Monday that just happened, you know, you may be facing some cuts. So bear with us on it, but that's kind of the plan. In regards to the second floor, Megan and myself and Councilor Jakutis, along with John from the mayor's office, Denise, can't think of Denise's last name. Littleton, is that her last name, who attends the center? She's in the chair.
Yes, that's
she's
her name.
Part of the committee as well. And
yes.
Laura Stockfish from facilities, we toured the second floor. And this was Diana's idea to have that meeting down there so that they could kind of see some of the renovations that were made on the first floor that don't feel like a good fit. You know, I think to just discuss that really quickly, those plans were drawn up long before Megan or myself got here. And they were drawn up by somebody who works in, you know, with senior centers. I don't know, you know, it was bid. We were kind of stuck with it because that's how it goes. But we really wanted to make a point of saying, you know, some of this isn't actually usable for us. So we went up to the second floor and said, you know, here's what we need. Here's how we intend to use this space. Don't give us space that we need to now fit into. Please build us the space that we want. So we were able to kind of sort that out. That work is going to be done in-house, just to save some money. So the city's staff will be, well, the city will be using what's called House Doctor, which is a contractor, a licensed professional contractor, private contractor who's got a contract with the city to do work like that for us. And it will not be as invasive as the first floor. I think it should be much easier than what we went through with the first floor. And I think they're hoping to start that sooner versus later. I know that myself and Megan and Diana have kicked in whatever comments that we wanted to make about the floor plan in writing. So hopefully we will be hearing soon about a date to get that started. So like I said, get the second floor open and running, get that extra van on the ground, get someone out there to drive those extra routes, and then just keep working to expand the services that we can provide, having more than one vehicle. Like I would like my goal would be at some point to be able to say, okay, every Monday, if you come to the senior center, you can do this, or you can do this, or you can do this, or you can get a ride to Market Basket because at 10 o'clock or 11 o'clock every Monday,
Right.
the van takes whoever signed up to go to Market Basket and then brings you back by this time. So if you wanted to get your food shopping done for the week, you know that you can do that every Monday by going to the senior center, right? And there may be some other locations that we can find that may be easy to kind of do a drop off and a pickup for people on a weekly basis or a monthly basis. And we will also be using that transportation coordinator to make sure that everybody at the senior center, and they'll be doing work for us down here in public health, is taking advantage of the low fare ridership offered by the MBTA. That's one of the biggest things we want to do, is make sure that people who are taking the bus, the subway, have access to being signed up for those low fare rides. So that's going to be a major piece of work that person will do too. So we're going to kind of share that person, but we'll figure out the details as we go. Any questions?
Yes, Mary, I have a question. When are they going to replace Mabel?
We have been working very hard. That job has been posted. We've had people apply. I am extremely committed to getting bilingual staff. I just can't in good conscience hire somebody who does not speak Spanish.
A lot of people speak more than one language.
Yeah. We've lost way too many people who speak Spanish down there.
Right.
So the first round of candidates that we got, no one spoke Spanish, so we've reposted it.
Good.
So we are working on it. We are working on
Wonderful.
Yeah.
Thank you.
I've also been looking for additional translation services to happen down there.
Right. Yes.
And we cannot find people, even on just a couple hours here and there to come down and do translation. But it's a priority, and it's constantly reaching out to people. I actually reached out to Rosemary Sargent, how many of you may know her. And she wasn't interested in doing it, but she said that she would ask around to see if she had friends. So if you know anybody who does that kind of stuff, please let me know.
I do know someone, because years ago when I worked at the hospital, Union Hospital, there was a woman that ran that whole unit. I will call Cynthia and see if she has anyone, and I'll get back to you with it. She was over the whole translation at Union Hospital. I'm sure she may know some folks.
Okay, awesome.
I'll do that, yeah.
Question regarding, you mentioned getting rid of the third vehicle. So we had two vehicles. One was inoperable. Is that what it was?
No, there's two vehicles right now that are operable.
And we're getting a third one now? How do we determine that we only need two rather than three?
We don't have staff for three.
Issue?
Well, we don't have staff for three. And one of them is relatively brand new, but it's not handicap accessible. So we purchased that with opera funds for you guys. So if that's going to be the one that's determined not to keep, we're going to repurpose that. And then if the one that is handicap accessible now, which kind of breaks down here and there, is the one that we're not going to keep, we'll figure out how to get rid of that.
So the one that breaks down is, so the one that's not handicap accessible, the senior center could still use it, right? I mean, not everybody needs handicap accessible. Does that work? Because if it's a newer vehicle, Might it be?
It does, yeah. I would want to speak to Megan about it and see like what she thinks the needs of the people who drive and stuff are. So we would just determine there's just no need for 3 vehicles. If one
Gotcha.
of them would just be sitting there all the time.
Got it.
Yeah, yeah.
Great. Thank you.
Mhm. Anything else? Smitty, you're awful quiet up there.
This is great news. The van is long time coming. Lisa, thank you, and Norris and all of you all that worked on this. This is very exciting, and it's going to be so helpful, and the other staff too. Appreciate your dedication to the language barrier to resolve that. We've got a lot of dedicated folks down there, and it's just language that's kind of hindering them from being full potential. So
Yeah, absolutely. I agree with that 100%.
that's great.
Yeah, yeah.
Thank you.
And to that point, if I can just say, following up, transportation is by far the biggest issue for aging, by far. So whatever we can do to really provide those services, because those are the service that once transportation becomes an issue, people lose access to the community. And that's really the biggest barrier. So
Yep.
Thanks.
All right. Is there anything else you guys want from me? Because if not, I'm gonna bug out, use the ladies' room before my next meeting.
Thank you for
guys
your
always
time.
know if you need anything, though, you can always email me, reach out to me, please. I will be down there in a couple weeks to call bingo. So if you have any questions, you can give them to me then too. Otherwise, appreciate all your help. Looking forward to like a good spring and summer with you guys and getting up on that roof deck and doing the gardens and all that stuff. And you'll all be happy to know too, Tanya signed another 3-year contract actually. So we've got her. She's very happy to, stay in place. And I think that's great. Yeah, I feel really good about that. I feel like, okay, the senior center has been through so much in just the year and a half that I've been here. And I'm just like, how much more can these poor people take? Like, it's just nonstop down there. Like, it's people moving in, it's people moving out, it's this, it's that. But I feel like we're past the worst of it and we're going to have some smooth sailing now. So, like I said, whatever you guys need, don't hesitate to reach out, okay? Thanks, guys. Have a good one. Bye.
Good, Lisa. Take care.
All right. Next on the agenda is the Friends of the Lynn COA. Exciting news there too. There's going to be nominations and elections in the coming months. There'll be flyers put up for people who want to join. I already found some others since I met with them a couple weeks ago that want to help out, that are, very committed to the center and to help raise funds. One of the ideas that came up to spend money on was that historically, I should say, and traditionally, one of the fundraisers and a popular event by those who participate is a ice cream social. And they had asked to plan one, but said there was a hindrance because there wasn't enough freezer space at the center. One idea was that we could get a volunteer to just bring the ice cream whenever it was time to serve it. The other idea was the friends could buy a small freezer for events like that to have extra space. So those are some things that the friends are working on. Whenever there is a obstacle or a challenge with space or with funding, the Friends is there to make sure that what those that attend want to do are able to see that through. And we're working with some other community partners. And so far, the last time I talked with the treasurer, our initial March fundraiser donation, they were up to almost $2,000 in single donations from people. So dedicated things like the exact money that the total money that was needed for the garden was given. So the center doesn't have to worry about that in the budget. And thank you cards were sent out to all of those. And there's been commitments to other things that are upcoming too. All of that just takes the relief on the daily operations budget of the center and provides relief. Many of the people who attend go to other centers. And, you know, for instance, it may be $5 at a center to do chair yoga, where at ours it's $2 to do. And that makes a big difference, especially somebody who participates on a daily or weekly basis. Those fees add up. So that's some of the things that we can help out and allow for more participation.
So that fundraiser the fundraiser in March, you say we got $2,000 there?
Yeah, an individual, you know, everything from $100 to $500 and commitments for even more.
Oh.
Mm-hmm.
Good.
Yes, and the beautiful thing of this too is it's really opening up opportunities for others to volunteer with the Friends. Because there's people that are very excited about having events at the senior center, but because maybe of lack of funds. And so this gives them an opportunity to take ownership and say, you know, we'd really like to have this, and then go into the community, their friends, their businesses they frequent, and say, will you help us pull this off? And they've got the tools now to be able to do that. You know, letters with the 501c3 so people can donate it. Exact listing of some of the things the senior center would like to have funded, the cost for the popular events. So yeah, it's really energized that arm of the center.
I have a question. I was looking through my email. Perhaps I was going to see the minutes of the last meeting so that I'll be able to look at it, but probably it was discussed. Now, in the face of the recent DOGE cutting funds and slashing things up and down, how has that affected human services, social services, and community in Massachusetts, Pam?
So in my full-time job at Mass Senior Action, we pay very close attention to the elder affairs budget.
Yeah.
And right now, the state, right now we're in the House budget part of the state, and everything that the COA receives for money comes out of the elder affairs budget. There's line items just for COA, and then the cities and towns also donate to that with special funding. So the House budget come out as if they're just going to go ahead and create a budget with what they have right now, with what they know. So I can't say that there is a direct cut to the COA budgets right now. One of the things that is pretty scary for many people is the cuts to nutrition programs, which does affect the Meals on Wheels and also the congregate meal sites. That's what they call the senior center lunch.
So, yeah, I heard you. Yeah.
I can tell you at Mass Senior Action, what we are doing is we're working with our state and federal
legislators,
representatives, because, you know, for the most part, none of them are saying, yeah, we should cut these things, right? Mm-hmm. So it isn't that we have to convince them to fight for cuts, but what they need are stories. So if you know somebody that is dependent on those nutrition programs or SNAP benefits, you know, a lot of people that are making less than $1,000 a month, SNAP is their only food source because the rest goes to housing or medical. So if you know those stories, share them with Congressman Moulton and with our state delegation.
Well, I do know that the Senator Moulton has been pretty much quiet lately. He has not been very talking on that issue at all. But like you said, I heard through the grapevine that Kennedy is going to be, doing some cutting when it comes to those budgets coming to the state and localities. However, if funding is going to be coming directly from the state, we just have to be prepared. So how prepared are we going to be? Because we want to make sure our senior citizens are sustained and the social services we provide for them is not affected, especially the Meals on Wheels. My mom, my parents, they were advantageous around that before their passing, and it was helpful for them because it's nutritious and it's geared towards what they actually need. So we need to pay attention. I don't know what we need to do to mitigate against such coming. That's just my own.
The other thing that has happened is they call it the gray tsunami, which I don't think is very nice, but it's about so many, a big group, a large group of people turning into that 65 to 75 range. And that prior to the Doge cuts, Massachusetts was looking at a real challenge to meet the needs of people who want to live in their home care. So like GLIS is an ASAP, and the ASAPs across, there are waits. They call it the waiting list. So you meet all the qualifications to receive home care. Your insurance or Mass Health covers it, but they don't have anybody. They don't have workers, or they don't have money to hire more workers. So that is going to be a big issue. There's also the personal care attendants, who is the next level of home care workers, who, take care of people who may have a tracheotomy or, need a little bit more medical care. There is also a freeze on how many, they're trying to cut the number of hours somebody can have for a PCA to spread that budget a little more. I don't know how you cut somebody's hours when the only way that they can get out of bed is with the PCA to put them in their vehicle, in their motorized wheelchair. Before that group, PCAs did a lot of younger disabled folks, but now over 70% of the people who need PCA services are 65 and over.
Wow.
So when that is being said, that is, what do? We make sure the community is aware of the need, and then we have to push our state to put those funding dollars where it's needed. And that's when the squeaky wheel gets the worm. That is us telling our electeds these are important. So. Okay. So if anybody would like to help with the Friends, just let me or Debbie know. We're working with them quite a bit. Another thing that I'm working with Tanya with, and Megan too, is the process for registering for events at the Senior Center. There was I think that it's okay if you go down there every day, the system works. But if you are somebody that would like to do something, maybe just once a month, by the time folks find out about it, it's too late to sign up, or it's full. Or maybe they just wanted to stop in that day because it was nice enough to walk down. But there's an event going on and they're at capacity, and so they're turned away at the door and said they can't come in. So we're going to try to find a better way to be more inclusive and to spread the word and to allow for that broader audience. And I do think that now that there's more room on the first floor, and if we do get the staff hired, that will make it easier to open up more spaces for people to participate.
How often, Pam, does that happen?
That someone is turned away?
Not very.
I would say not often, but I think that it's potential for the very popular big events.
Okay.
And my concern whenever this happened is because not everybody is able to get down there or go there every day, or they may not want to. They do other things.
Mm-hmm.
It's, oh, here, I'm going to go check out the senior center. And it's a day that it required registration ahead of time. And then they're turned away. Is that person ever going to come back again?
Mm-hmm.
It's very discouraging,
Mm-hmm.
especially if you're just somebody that's trying to find out if you want to go to the senior center and that's how you're met.
Mm-hmm.
Well, so then the question is, what's the process by which, if somebody is late or didn't register for event, is there sort of an overflow event for them so that they can at least be in the space and just see if it's what they'd like? Is there a maximum capacity in the building that we can't exceed and that's why they can't come, or you know what I mean?
I think so. I would think so.
It is some of that, the maximum capacity, with the fire department, fire marshal. There is that, but I also think that there's just maybe a lack of communication and understanding too, mm-hmm. that we can improve on.
Okay.
Debbie?
So I just wanted to mention, Pam, going back to the Friends, there is a meeting of the Friends this Thursday morning at 9:00 at the Senior Center, and we will be having nominations of offices at that point.
Thank you, Debbie.
Yeah.
And I'm sorry, the 24th at what time?
9 a.m.
Thank you. All right. I think that's all that we can do. Oh, go ahead, Debbie.
And Pam, I just wanted to mention, I sell raffle tickets for the Friends at a lot of the major events that they have that people sometimes have a hard time signing up for, mainly because of capacity. And there have been times that people have come down not having any idea that there was an event going on and decided to stop by. And I have to say that they have been very accommodating by trying to at least give them a tour, even though they're very busy. They try to accommodate them as much as they possibly can. They don't just turn them away at the door and say, I'm sorry, you're not welcome here today. So they try to make it as comfortable as possible for them.
Must have just been when I was there last Thursday. Mm-hmm. I've seen 2 turned away.
Oh, God.
So,
yeah, I haven't seen that.
Yeah. And some of the folks called me that witnessed it too. Didn't realize I had seen it. So, yeah. But we are working on it. We have a commitment from staff to work on it. So that's the main thing.
Mm-hmm.
But the event reservations came from people who attend, asked it to be on the agenda. So that's why I even brought it up today. Right. All right. Anybody have anything else?
On the agenda here, it has a few things. Senior Center staff needs. Are there any that we should know about?
It's I believe that Lisa tried to answer that. It's a person, the last person left, Mabel.
Mm-hmm.
Gotcha.
Yeah.
Any upcoming volunteer opportunities that we should know about?
Yeah, I don't know any of
Okay.
those. Yeah,
Gotcha.
the rest of the things I don't know about.
Gotcha. Okay, that's kind of Megan territory,
Mhm.
right?
Yeah,
Alright. Okay. Great.
thank you. All right, so us as a group, I don't know. I believe at the last meeting, we all decided that Zoom works nice for this group rather than going to the center until there is an open house.
Mhm.
We would need a motion for our May meeting, which I believe is on the 28th. And then, yeah, it would be May 28th. Do we want to continue by Zoom for the May meeting?
That's upon it.
No question.
John, you make a motion?
And I
Yes, I
second it.
do. I do.
Okay. All right. All
Two
those in
hands in the
favor?
air.
All
Aye.
those in favor can
Aye.
wave or say aye.
Aye.
All right.
Aye.
Okay.
All right. Well, motion to adjourn.
Is that
Mhm.
Betty that is beside Mr. Arthur?
Yes, it is. It is Betty by
Wow.
Mr.
I haven't seen Miss Betty. I haven't seen you in a long, long time since I was a baby.
Well, I was in the other one before. By the phone too.
Yeah, it was, Betty.
Oh,
John missed last month, and Betty was here last month, John.
Right.
So yeah.
Okay.
And when I don't make it, I send a message. I'm sorry, I am sick or something like that. But I'm all the time by my excuse or be there if I can.
Well, you know what? I'm gonna say Happy New Year.
Yeah, you know, yeah, you have one day they remember. I don't
Mhm.
forget you.
I'm sorry.
Mhm.
Okay, thank you. Good to see you.
You always need one.
Great. A motion to adjourn. Did I see Mr. Arthur's hand? Motion to adjourn.
Sure.
All right. Smitty says he's second. All those in favor, say aye.
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 Thank you all. Have a good
day,
very much.
everyone.
Enjoy
Bye-bye.
the spring weather.
Oh, I'm
Yes.
enjoying it. I'm
Thank you.
on my way to Boston.